Hello.
How can I help you?
I'm not sure.
Okay, are you here to pick up a prescription?
I think so.
Okay, what's your name?
My name is Gavin.
Okay, and are you picking up a prescription for yourself or someone else?
I'm not quite sure.
Okay, let me look you up in the system, and it looks like we do have one for you. Is this a new prescription for you?
I don't know.
Okay, I see in your profile that we have never seen you take this medication before, so if you have some time, I'd love to sit down and talk with you about it. Just make sure you know how to take the medication and get the maximum benefit from it. Would that be all right?
Sounds good.
Okay, let's go ahead and take a seat. My name is Sydney. I'm the pharmacist today, so let me just make sure that we have your profile up to date, if that's all right. Is your date of birth 12/11/57?
I believe so.
Okay. And are you still on 1234 Wonderland Lane? Is that correct?
Yeah, I think so.
Okay. And then is your phone number still the correct one, the same one that you had last time, the 555-555?
I hope so.
Okay, sounds good. Okay, so the medication that your doctor prescribed for you today is called Humira, and you'll see it on the medication label right here. Another name for it is adalimumab, and so that's the generic name, so obviously it's a lot easier to say Humira. That might be a little better. So what did your doctor tell you to expect from this drug, or what did he tell you you're taking it for?
He didn't really tell me anything about it. But...
Okay, so let me kind of explain. This drug is for rheumatoid arthritis. Are you having kind of some pain in your joints, having some trouble with that? I see you've been diagnosed with it recently.
I think so.
Okay,
I think so.
sounds good. So this is for rheumatoid arthritis, and it's hopefully going to help with any kind of pain that you've been having and help that pain decrease. That way you're not having so much trouble, walking around, going about your day-to-day activities.
Okay.
Now, how did your doctor tell you to take this medication?
I can't remember off the top of my head.
Okay, let me go over it with you, and everything that I mentioned is also going to be on this medication label right here that I'm going to give you at the end of the conversation.
Okay.
So you're going to take 40 milligrams subcutaneously every other week. So that's just going to be one injection that you're only doing every other week. And how you're going to do this is subcutaneous, that means in the fat. So you're going to want to put it into the fatty part of your skin, and a good place to do that would be kind of around the belly button area.
Okay.
So every other week, just make sure you're injecting it in this area, and just be sure to kind of rotate sides. So if you do it here the first time, I would say an easy thing to do is just kind of, make a circle around the belly button, and that may be easy to remember. Another thing to keep in mind is not to shake the medication. It's going to come in an injection, and you don't want to shake that liquid. Just keep it as it is, but don't use it if it's kind of cloudy. Just call me if you pull it out of the package and you notice it's cloudy. You just want to use it if it's a clear solution.
Okay.
All right, so other than that, have you been getting your blood work done with your doctor?
I can't quite remember.
Okay, I would just be sure to keep in contact with him, make sure you're getting all the proper blood work that you need. I'm sure he has checked you to see if you have tuberculosis, which is an infection, kind of causes some cough. So that's something standard that they do at the doctor's office just to make sure you're clear to go on this medication.
Okay.
Okay, what did your doctor tell you to expect from this medication?
I can't remember anything that he told me.
Okay, let me kind of go over some of the side effects with you. So if you notice you're getting kind of a headache, upset stomach, I just want you to know that that is something that can be normal from this medication. But some of the severe ones, and these are more rare, keep in mind they're rare, so they're hopefully not going to happen to you, but I do want you to be aware of them, is if you notice you're getting an infection like weakness, chills, fever, dark urine, I want you to call me or your doctor immediately, okay?
Okay.
Okay, as far as storage goes, just keep it in the refrigerator. Try to keep it away from light, away from heat, and anything like that. Nothing too fancy. All right, well, I've gone over a lot of information today. If you wouldn't mind, just to make sure that I've been clear, could you repeat back how you're going to take the medication?
I'm going to take it subcutaneously in my skin fat, make a circle around my belly button.
Yes, that is correct. So it's just a 40 milligram injection into the skin fat. That's what subcutaneous means, every other week. And do you have any other questions or concerns, or
Not off the top of my head.
is there anything else I can address for you? All right, well, I am going to put my contact information on this prescription, and you will be able to contact me at this number. If I'm not here, any of the other pharmacists would be happy to help you. You'll